Padmavati, okay irukungala? Rendu kaal surgery finish aayirukku, okay? Successful aayirukku. Like it looks like an astronaut wearing helmet, right? So this is generally we use it for replacement procedures because replacement procedures are very important cases and we prefer it to be as sterile as possible. So the operating surgeon got to wear this helmet. Over this, the hood will come so that when we breathe, the whatever I'm breathing should not touch the surgical part. So it has to be as sterile as possible. So these are the reasons, the precautions that we take. So she's a 69-year-old female patient with both the knees severe arthritis, advanced arthritis what we call. So this is a routine bilateral knee replacement, robotic knee replacement. So we prefer to do both the knees simultaneously if the patient is under 70 years, medically fit, the cardiologist fitness is given, and everything is good. We prefer to do both the knees simultaneously. Generally, the surgical duration will be under 2 hours for both the knees, so around 45 minutes each knee. So that's what our usual timing is, but let's see how this case goes. Okay, that's a gap balancing in flexion. Okay, good. So come to the calculations, please. Keep a medial opening varus of just 1 degree. It goes in calculating this gap balancing. So we need to do some measurements and we need to fix this robotic in such a way that our gap balancing is close to 0 on both flexion and extension. Release the robotic arm, please. So if you can see, the robotic arm doesn't move, it doesn't come by and operate by itself. So it's going to be in our hand. So that's why it's very safe, but the precision belongs to the robot. So what you are seeing, this green color zone is the robotic zone. So our robo saw works when you are in the robotic zone, and the blue color patch shows that the amount of roughness that is there and we need to clear that roughness. So when we get a perfect smooth shape back after clearing those blue areas, our new implant or new lining will sit perfectly on the knee. Alright, that's our trial fitting in. So we'll punch the trial some more and see what is the angle that is sitting inside the knee. Yes, so clinically it looks straight and perfect, and let's see the computer. Yes, yeah, so can you see the 0 degree there? So that's a perfect straight line what we have got. Okay, so that's the realignment of the knee. So now the patient will be able to walk with a perfect knee from 70 degree bend to perfect 0 degree alignment. That's the precision of the robotic. Alright. That's the first lining going inside. This is for the leg bone. Liner, which goes between the two lining, new metal lining. It acts like a cushion. So then last we are going to put the femoral lining. The right knee is done now. So now we are going to see how the patient is doing, and then we'll discuss with anesthetist. Everything is good, then we will go for next knee. Padmavati, okay irukungala? Rendu kaal surgery finish aayirukku, okay? Successful aayirukku. Nee okay lala? Okay, done.